Good morning, everybody. Thank you for coming to listen and allowing us to present our Grand Rounds case. So, my group had Burton Ernie, and he had a closed head injury. So, a little bit of background information with Burton. He's a 20-year-old male. He's in college, a senior, majoring in chemistry. It's important to note that he's left handed. Unfortunately, he accidentally fell down a case of stairs, which resulted in his closed head injury. He was unconscious for about 15 minutes before help came, and while he was at the hospital, scans showed that a decreased intracranial pressure, but a necrosis near the inferior gyrus of the frontal lobe around Broca's area was noticed. When Burton was at the hospital, he was also given the Rancho Los Amigos Levels of Cognitive Functioning Scale, which revealed a score of 7.
The overview of our case: Burton was given a few assessments to test his overall functioning. So for spontaneous conversation, a speech sample was gathered through spontaneous conversation and through oral reading of the grandfather passage. The oral mechanism exam, an oral mech, was conducted to assess Burton's oral structures and their abilities. For the bedside swallow evaluation, it tested to see if Burton presents with any signs of dysphagia or trouble in the oral, pharyngeal, and esophageal phase. He was also given a modified barium swallow study. It was completed upon recommendation following the bedside swallowing evaluation. The modified barium swallow study will give more information regarding the cause of his swallowing issues. He was given the CLQT, which is the Cognitive Linguistic Quick Test. It assessed Burton's strengths and weaknesses in 5 cognitive domains that would be attention, memory, language, executive functions, and visuospatial skills. He was also given a participation inventory, and the participation inventory was completed to see if an AAC device would be beneficial for Burton. Now we're going to go over Mr. Burton's speech results. The spontaneous conversation that was obtained by asking a series of questions like what was his name, what was his favorite hobby, what was his favorite sport, etc. The results for the spontaneous conversation showed that Mr. Burton needed moderate cueing when asked questions about his favorite hobby, sport, etc. So when Mr. Burton was asked what was his favorite hobby, he would kind of just be like, I don't know, and things like that. So moderate cueing was needed. Mr. Burton was also given the grandfather passage, and that was used to test his speech, fluency, and voice. Those results revealed that Burton's speech was 100% intelligible to an unfamiliar listener. However, he presented with harsh vocal quality and a slower rate of speech during spontaneous conversation. This assessment also showed that Mr. Burton had left-sided neglect.
So now on to the oral mechanism exam. So during the oral mech, it was observed that Burton had buccal air escape, lip and tongue weakness, had a harsh raspy voice, as well as a slow rate of speech. But everything else, such as like symmetry of his face, mandible, all that kind of stuff was within normal limits. So with the diadokinetic rates, they all fall below the typical range for a 20-year-old male. So we can see with P and T, he had a 1.5 syllable per second, and then with K, 2 syllables per second, and then we combining P and T together, it was 1.2 syllables per second, and then combining P, T, and K, so Putaka was 1.08 syllables per second, which all are pretty low. So we would recommend that Mr. Burton have some breathing exercises, articulation drills, as well as some oral motor exercises to kind of build up that strength in his lips and his tongue, and maybe speed up his rate of speech just a little bit and see how that goes.
In order to ensure that we assessed all potential areas of concern, we did a bedside swallow assessment. This revealed that Burton had a slow mastication rate with semi-solids and solids, and he complained of these foods sticking to his throat. Anterior loss of the bolus was present with normal cup silk following his solid intake. A throat clear was also noted many moments following his semi-solid intake. In order to identify a more accurate etiology of these issues, a modified barium swallow study was ordered by the physician. The results of this revealed that Burton had a profuse escape of liquids between the lips beyond the chin, which is a score of 4 on lip closure. The bolus escaped to the right lateral buccal cavity, which is a tongue control during bolus hold score of 1. He had a slow, prolonged mashing and chewing with complete recollection, which is a bolus preparation score of 1. He had slowed tongue movement, which is a bolus transfer / lingual motion score of 2. He had collection of residue and amount remaining from the original bolus presentation sufficient to extract, which is an oral residue score of 2. The bolus head was at the valleculae, which is an initiation of pharyngeal swallow score of 1. And there were no indications of pharyngeal or esophageal impairments observed. Services are recommended to address all areas of impairment within the oral phase of swallowing.
Now I will be talking about our patient CLQT results. We administered the CLQT to assess the strengths and weaknesses in the 5 cognitive domains listed: attention, memory, executive functions, language, and visuospatial skills. So in the attention section, our patient's attention domain index score was in the moderate range. In the memory, his domain index score was in the severe range. The executive functions domain index score was in the severe range. The language domain index score was in the severe range. And the visuospatial skills domain index score was also in the severe range. While administering the CLQT to our patient, we noticed that he perseverated during the naming task, and he was also unable to use his left hand, which is his dominant hand, for the writing task. When he was asked to do a writing task, the patient did not acknowledge the left sides of the paper, as well as not acknowledging his left hand like we had said. And while giving the assessment, the patient was cooperative, but he did fall asleep a few times during various of the subtests and had to be reminded to stay awake and try and get through the assessment if at all possible. But in conclusion, the composite severity rating of the traditional administration of the CLQT indicated an overall rating of severe impairment for our patient. In summary, based on all the assessments given, Burton exhibits a moderate to severe cognitive linguistic impairment and mild oral dysphagia. He presented with anosognosia with his left-sided neglect during his evaluation.
For the plan of treatment for Burton, he will attend therapy sessions at Speech City Clinic 1 time a week, accompanied by whoever wants to bring him, and these will be 60-minute individual sessions, which will be direct therapy. Some techniques that we'll utilize will be cognitive rehabilitation therapy, which will include some internal memory strategies such as mnemonics and rehearsal training that he can just use in everyday situations to remember easily, as well as using external memory aids. And we were thinking about how in class he might have to utilize those once he is back in school. Then he will use those external memory aids when taking notes or using a highlighter. He can utilize that in class whenever there is class discussions or reading a book together. Burton can be shown how to use those. Also, some auditory drills for sustained attention as well as working memory. Auditory drills are really great for any type of cognition issues, and will just help his brain to just get that working memory back together, as well as keeping him on task with that sustained attention deficit. Also using visual scanning therapy a part of his left neglect. He sometimes didn't read the whole page, so using that therapy technique of visual scanning will help him to remember to use that left side of his brain and read from left to right, or do a task from left to right, whatever it shall be. And also for swallowing, we have rehabilitative techniques, which would be like oral motor exercises to help that lingual movement, as well as the his facial droop, that oral, just the lip closure. So using those oral motor exercises to help it gain strength and movement will overall help Burton's treatment. And then some activities that we'll use are reading some books, answering questions from those books, and also like school-related worksheets. So Burton was in college, and then he is now out of it due to his TBI, and really getting him back in the groove of going back to school and doing those kind of activities is very important for his growth. Also, some environmental arrangements will be put into place to accommodate for his left neglect. So we will sit on his right side or move the paper to his right side just to make sure that he is comfortable and is set up for success. Also, we will challenge him with putting things to the left side, but that will also be in the visual scanning therapy technique. But ensuring that he is put in the right place for success will be beneficial for his overall treatment. Now we're going to talk about the long-term and short-term goals that we made for Burton as far as his cognition goes. The long-term goal 1 is by May 2025, Burton will improve his cognitive linguistic skills to increase his ability to participate in classroom activities with minimal, which can be 1 to 2, cues, increasing from 0% to 80% of the time. And then the short-term goals that go underneath this goal that'll be leading up to this goal is, the first one is, when giving questions from a book or passage read, Burton will improve his working memory skills by answering 2 out of 3 questions correctly with 1 verbal or visual cue for 3 therapy sessions. The next goal is Burton will complete sustained attention tasks during a structured activity with no more than 1 redirection for 5 minutes for 3 therapy sessions. The last goal is, when given a passage, Burton will read it aloud independently with no more than 1 error over 4 therapy sessions. All of these goals will help his cognition and are all aimed in classroom activities to help Burton get back to the classroom and be able to participate like all of his peers. The next long-term and short-term goals we have for Burton are related to his swallowing issues. The first long-term goal we set for this one is by May 2025, Burton will utilize compensatory strategies of swallowing function on PO intake, which means by mouth, independently, without overt signs of aspiration for the most appropriate diet level. And then the short-term goals follow up to that long-term goal. And the first one is Burton will complete 2 out of 3 trials of labial restorative oral muscular exercises such as lip press resistance, and puffin cheeks, given 1 to 2 verbal and tactile cues over 3 therapy sessions. And the next short-term goal we have for him is Burton will complete 2 out of 3 trials of oral motor exercises to increase lingual range of motion, strength, and coordination with 1 to 2 verbal cues for effective bolus formation over 3 therapy sessions. All of these goals should help overall improve Burton's swallowing abilities.
For our treatment session, we chose to focus on the goal that relates to working memory skills. In order to work on this, a passage from Burton's chemistry book will be read aloud. Burton will be provided with a copy of the passage, and he will be given external memory aids, such as a highlighter, to help him stay on task and underline keywords from the passage. When asked a question related to the passage, Burton will be able to use these external memory aids to help guide him to the correct answer.
So here we have our diagnosis and billing codes. His medical diagnosis was a traumatic brain injury, and the ICD code is SO6.2. And he also had another ICD code of R41.84, which is a series of cognitive deficits following a TBI. His treatment codes, he had a moderate to severe cognitive linguistic impairment and mild oral dysphagia, so his ICD codes were R41.841 and R13.11. And then we have his CPT codes, which we had one for standardized cognitive performance testing, evaluation of oral and pharyngeal swallowing function, evaluation of speech sound production, therapeutic interventions that focus on cognitive functions, and treatment of swallowing dysfunction and or oral function for feeding. Thank y'all so much, and if you have any questions, please let us know.